Every 65 seconds, someone in the United States develops Alzheimer's, the most common and devastating form of dementia. Yet tragically, most early signs are ignored, dismissed as mere normal aging, but they're not. Dementia isn't a single disease. It's a broad syndrome that disrupts memory, thinking, communication, and daily functioning. And while it progresses over time, the earlier it's recognized, the more we can do to slow it down. Early diagnosis means access to treatments, lifestyle changes, and support systems that can dramatically improve quality of life and preserve independence. Unfortunately, many people don't seek help until it's too late. In this video, we'll uncover the 10 early warning signs of dementia that must never be ignored. Each one may appear small on its own, but together they paint a picture of deeper cognitive decline. Watch closely. Recognizing even one of these signs early could save your life, or someone you love. Number 1, memory problems. Memory loss is often the first and most obvious sign of dementia. But not all memory issues are created equal. It's normal to occasionally forget names or where you left your phone. But dementia-related memory loss is persistent and impacts short-term memory first. A person may repeatedly ask the same questions, forget recent conversations or events, miss appointments or meals, struggle to retain new information. Interestingly, long-term memory often remains intact, making it harder to recognize the problem. Someone may vividly recall events from 30 years ago, but forget what happened an hour ago. This inconsistency causes emotional distress. Many people recognize something is wrong before anyone else does. They might start avoiding conversations or relying heavily on notes. Loved ones are often the first to spot repeating questions or missed events. If these symptoms become frequent and disruptive, it's time for a professional evaluation. Memory loss isn't just a symptom, it's often the first red flag. Number 2, difficulty with familiar tasks. Struggling with everyday tasks is another early and concerning sign. These aren't new or complex activities. These are routines the person has done thousands of times. Examples include following a familiar recipe, managing finances or paying bills, using a smartphone or remote control, operating household appliances. They may skip steps, forget why they started the task, or become overwhelmed midway. This reflects a breakdown in executive function, the part of the brain responsible for organizing, sequencing, and completing multi-step tasks. Emotionally, this creates frustration, embarrassment, and a growing reluctance to participate in daily responsibilities. Over time, the person may withdraw from things they once managed confidently. If you begin noticing repeated errors in daily tasks, don't dismiss it as a bad day. When routine becomes unfamiliar, the brain may be struggling with early-stage dementia. Number 3, language and communication problems. Language difficulties are often one of the first cognitive signs that something's wrong. A person may experience word-finding problems, anomia, such as calling a pen the thing you write with, difficulty following conversations, repetitive speech or storytelling, decline in reading comprehension and writing clarity. As dementia progresses, maintaining a conversation becomes exhausting. The individual may repeat themselves, lose track of the topic, or struggle to understand multiple speakers. This isn't just forgetfulness. It's a breakdown in the brain's language centers. Reading becomes hard, writing gets disorganized, and speaking turns into a source of stress. For caregivers, the best approach is to speak slowly, use simple sentences, and allow time to respond. Finishing their sentences may feel helpful, but it often increases frustration. If daily communication becomes difficult, consult a neurologist or speech-language pathologist. Early support can preserve dignity and connection. Number 4, disorientation to time and place. Being confused about the time or place is a major red flag. This goes beyond forgetting the day of the week. It includes thinking it's morning when it's evening, dressing for winter in the middle of summer, getting lost in familiar places, even at home. This occurs because dementia affects the brain's spatial and temporal awareness. The person may forget how much time has passed, confuse recent events, or misjudge when something occurred. Safety becomes a concern. A disoriented person might miss critical appointments, wander outside at odd hours, leave a stove on, or take medications incorrectly. Continue driving despite not remembering the route. These are not harmless slips. They're signs the brain is losing its orientation map. If you notice consistent confusion about time or location, it's time for urgent medical evaluation. Disorientation puts lives at risk. Number 5, poor judgment and decision-making. One of the more dangerous signs of early dementia is impaired judgment, especially when the individual doesn't realize it's happening. Watch for overspending or giving away large sums of money, falling for scams or suspicious offers, ignoring hygiene or wearing inappropriate clothing, unsafe driving or refusing care when it's clearly needed. Even social filters may disappear. resulting in inappropriate comments or boundary violations. These decisions aren't simply careless. They result from cognitive damage affecting the brain's reasoning and impulse control. Families may struggle to manage these changes without seeming controlling, but early planning is essential. Put financial and healthcare protections in place, powers of attorney, healthcare directives, routine safety check-ins. Poor judgment isn't just about money, it's about risk. Recognizing it early can prevent disaster and preserve independence longer. Number 6. Misplacing things and losing ability to retrace steps. Misplacing items becomes problematic when it follows unusual patterns. Milk in the pantry, keys in the freezer, shoes in the oven. The danger lies not just in losing things, but in being unable to retrace steps to find them. This often leads to accusations of theft, tension with loved ones, and confusion that compounds emotional distress. Over time, lost medications, IDs, or hazardous items can lead to emergencies. As dementia progresses, the individual may need environmental modifications, labeled drawers and containers, designated places for essential items, use of GPS or item trackers in early stages. This isn't simple forgetfulness, it's a breakdown in logical memory. Misplaced items in bizarre locations should never be ignored. Number 7. Mood and personality changes. Mood and personality shifts can be among the earliest and most painful signs of dementia. A cheerful, patient person may become irritable or anxious, depressed or emotionally flat, paranoid or fearful without clear reason. Social interactions may become strained. Outbursts can occur over minor frustrations. Some individuals may withdraw, sensing that they can no longer function as they once did. These aren't personality flaws. They are neurological changes. Families must remember, this isn't just aging or intentional behavior. The brain is changing, and so is emotional regulation. Professional support may include behavioral therapy, antidepressant or anti-anxiety medications, structured environments and predictable routines. Early empathy and proper medical care can reduce suffering and preserve family bonds through the changes ahead. Number 8. Social withdrawal. Gradual withdrawal from social life may seem like a harmless preference, but it often signals deeper cognitive trouble. Watch for signs like skipping regular gatherings or hobbies, avoiding work or community activities, making excuses to stay home. Why does this happen? Individuals may feel embarrassed by memory lapses, struggle to follow conversations, or feel overwhelmed by social pressure. Over time, this isolation worsens cognitive decline, depression, and dependency. Families should gently encourage re-engagement, such as one-on-one outings, familiar, low-stimulation environments, structured routines. If withdrawal persists, seek a cognitive or mood evaluation. When someone pulls away, it may not be by choice. It may be a cry for help. Number 9. Changes in sleep patterns. Persistent sleep disturbances are more than inconvenient. They are warning signs. Common issues include insomnia, frequent waking during the night, daytime sleepiness or reverse sleep cycles, nighttime wandering or agitation. These changes may be caused by brain degeneration affecting sleep cycles, medication side effects, depression or anxiety. Poor sleep worsens memory loss, fall risk, irritability, caregiver exhaustion. Start with basic sleep hygiene, regular sleep and wake times, no caffeine late in the day, soft lighting and calming pre-bed routines. If needed, consult a sleep specialist. Disrupted sleep isn't just tiring, it's a neurological warning sign. Number 10. Visual and spatial difficulties. Visual and spatial issues go beyond eyesight. They reflect how the brain processes visual information. Early warning signs include trouble judging depth, stairs, curbs, difficulty reading, skipping lines or losing place, misjudging distances while driving, fear or confusion with mirrors or reflections. These issues can lead to falls, car accidents, getting lost in familiar environments, anxiety and fear at home. Supportive steps include improving lighting, using contrast colors for edges and floors, clearing walking paths, labeling rooms and items clearly. Occupational therapists can also help adapt the home. If someone begins to struggle with movement or navigation, it may be their brain, not their vision, that needs help. Dementia is progressive, but when caught early, its most devastating effects can be delayed. These 10 warning signs may appear subtle at first, but they are your brain's way of asking for help. Memory loss, disorientation, mood changes, language difficulties. None of these should be dismissed as normal aging. If you or someone you care about is showing even one of these signs consistently, don't wait. Get a medical evaluation. Early diagnosis opens the door to treatment, planning, and essential support. Comment below if you've noticed these signs in someone close to you. Share this video to raise awareness and possibly save a life. Subscribe for more expert-backed health education. When it comes to dementia, Awareness isn't just knowledge, it's protection. Catching it early can change the outcome forever.